Welcome to the SABC News COVID-19 Global Wrap, where myself, Babalole Phaka, and my colleague Busisiwe Khatebe bring you highlights of stories which dominated news headlines with regards to the coronavirus pandemic. But before we delve into it, let us have a look at some global stats. The world currently sits at over 93 million confirmed COVID-19 cases, with over 66 million recoveries and over 2 million deaths. South Africa currently has over 1.2 million confirmed cases, with over 1 million recoveries and over 35,000 deaths.
Staying in South Africa, a Johannesburg matric exam marker has died after contracting COVID-19. Her colleagues are under isolation. This comes as provincial education departments are scrambling to find replacements for hundreds of matric exam markers who have pulled out at the last minute. The second wave of the coronavirus pandemic has resulted in markers withdrawing because they are either ill, have been exposed to a positive person, or have cited fear of exposure. The health department has denied reports that pharmaceutical company AstraZeneca cannot sell vaccines in South Africa. According to recent information, AstraZeneca has confirmed that it will not be able to sell its vaccine in South Africa as it has no right to do so, contrary to government promises. These rights are held by the Serum Institute of India, the largest manufacturer of the Oxford AstraZeneca vaccine in the world. Meanwhile, Health Minister Dr. Zweli Mkhize emphasized the importance of people's willingness to take the COVID-19 vaccine, saying the public needs to ensure the safety of each other. South Africa will receive the first 1 million doses of vaccine in January and another 500,000 in February. Priority will be given to the country's more than 1 million healthcare workers in both the private and public sectors. On to the rest of Africa, the continent has now recorded over 3.1 million confirmed COVID-19 cases, with over 2.6 million recoveries, and the death toll stands at 75,840. The African Union secured 270 million vaccine doses for the continent, where a second wave is infecting about 30,000 people a day. The vaccines will be supplied by Pfizer, AstraZeneca through an independent licensee, Serum Institute of India, and Johnson & Johnson. Malawian President Lazarus Chakwera has declared 3 days of national mourning after 2 members of his cabinet succumbed to COVID-19 related complications. Meanwhile, Algerian President Abdelhamid Tebboune flew back to Germany on Sunday for treatment for complications in his foot resulting from a coronavirus infection, the presidency said. And lastly, in the Middle East, Israel may include children over the age of 12 in groups receiving COVID-19 vaccines within the next 2 months if research shows this is safe, a top health official said on Tuesday.
In international news, in the United States of America, hard-hit California has begun to display some early signs of a decline of its COVID-19 spike. However, a top state health official cautioned that the crisis remains far from over. Health and Human Services Secretary Dr. Mark Ghaly said new hospitalizations declined to 2,500 between Tuesday and Wednesday, from a previous daily average of around 3,500 new admissions. Other promising trends include a reduction in confirmed daily cases, with 36,487 cases reported on Tuesday, down from a 7-day average of about 42,000 cases every 24 hours. Ghaly said these figures marked the lowest rate of increase since late October 2020. The U.S. remains the worst affected country in the world, with over 23 million of its citizens infected with the coronavirus. In South America, health authorities in Mexico aim to fast-track the authorization of Russia's Sputnik V COVID-19 vaccine after getting access to data on it. The country's leading COVID-19 expert, Lopez Gattelli, said Mexico is considering 24 million doses of Sputnik V, while the country has already authorized vaccines developed by Pfizer Inc. with BioNTech and AstraZeneca. Meanwhile, Britain issued a travel ban to Brazil and several other South American states following new evidence of a new coronavirus variant in Brazil. In Asia, Malaysia announced a state of emergency in efforts to contain the spread of COVID-19, while the Japanese government plans to extend its state of emergency declared for Tokyo last week to 7 additional prefectures. In South Korea, a recent COVID-19 cluster has been linked to a religious group gathering in North Gyeongsang province. As seen in a CNN report on Thursday, the country's Disease Control and Prevention Agency said a total of 713 people linked to the gathering tested positive for COVID-19. The agency added that more than 1,300 people who were in attendance had not yet been tested and were urged to test immediately. In Europe, Spain recorded a record 38,869 new COVID-19 infections on Wednesday following the Christmas holidays. While government officials attributed the spike to non-adherence to rules over the festive season, Madrid's chief health official Enrique Ruiz Escudero placed partial blame on the new contagious variant first identified in Britain last year. And in some medical developments, a United Kingdom study by scientists at Public Health England found that people who have had COVID-19 are highly likely to have immunity to it for at least 5 months. However, some evidence suggests that people with antibodies may still be able to carry and spread the virus. And finally, an international team of scientists led by the World Health Organization arrived in the Chinese city of Wuhan on Thursday in a bid to probe the origins of the novel coronavirus that sparked the pandemic. The team, which will spend 2 weeks in quarantine upon arrival, will also spend an additional 2 weeks interviewing people from research institutes, hospitals, and the seafood market in Wuhan, where the new pathogenesis of the virus are believed to have emerged.
For the latest updates on the coronavirus, visit sabcnews.com.